Assalamualaikum viewer, another interesting video regarding gender sign part 2. Viewer, please watch the video till the end. In this video, we'll like to discuss the life case, relationship of the placenta with the gender, heart rate association with the gender, other signs in the pregnancy that are associated with the gender. Please watch the video till the end. It's very important and interesting video. This is the case of the lady that is having first baby with low-lying placenta. Does placental position affect the gender? We will find this answer in this video. Placenta may be anterior, posterior, or it may be bilobed placenta. Coming to the life case, this is the hypothalamic view of the baby, and I would like to calculate the BPT and HC to find out the age of the fetus. The fetus is at 30 weeks of pregnancy. You can measure the BPD and the HC at the level of hypothalamus. There is no cord around the neck. You can do the power Doppler study to find out the cord around the neck. Where the cord around the neck is very important in deciding the future outcome of the pregnancy. See the heart rate and the fetal cardiac activity. Fetal cardiac activity show the live fetus. If it is not there, there is chance of intrauterine death of the baby. So, heart rate may be associated with the baby gender. That's true. Heart rate is lower than 140 per minute. There is the probability of the male gender. Low heart rate may be due to the androgen secreted by the fetus. So, coming to the life case again, we like to calculate the heart rate with the help of wave pattern. From one peak to the other peak of the wave may show the heart rate, and in this case, this heart rate is less than 140 and the gender could be the male, and we will discuss it in the coming frames of this life case. So the fetal heart rate is 121 per minute, so there could be the probability of the male fetus in this pregnant lady. So there is no specific association of the placental position in the gender determination. Placenta could be the posterior and there could be the male. Placenta could be the anterior and there may be female gender. I can show you in different videos the female that is having anterior placenta and female baby, posterior placenta and the female baby. In this life case, there is low-lying placenta and the gender is most likely male. So this is another video that is showing the anterior placenta, but the gender you can see is the male. This is another video that shows the female gender and the placenta is in the posterior position. So placental position does not affect the gender. The backbone and the spine of this fetus is okay. Now I'd like to calculate the abdominal circumference to find out the fetal weight as well as the age. I am also going to elaborate or focus on the femur length. This is the femur length. It also corresponds to 30 weeks of pregnancy. So the fetal weight is about 2 kg and the fetus is at 30 weeks plus 5 days of pregnancy with the low-lying posterior placenta. So there may be some other signs associated with the gender reveal like morning sickness, mother behavior, urine pH and the shape of tummy. They can help in predicting the gender of the baby. So this is the femur length and you can see the gender that is male. There is turtle sign or the penile tip present between the two femur bones. So the gender is male. with low-lying placenta, and the position is posterior, and the heart rate is less than 140 per minute. Now we'd like to calculate the cervix length. See the backbone as well. So there is more morning sickness sign, that is vomiting in the early morning in case of female baby. The urine is more acidic when the baby is female. There is more depression in female when she is carrying a female baby. The urine pH can be tested with the help of a litmus paper. The red color show the acidic pH of the urine, that is due to estrogen and progesterone hormone secreted in the urine that show the female gender. So this is the cervical length, that is 4.3. Normal varies from 3.5 to 4.5. Less than 2.5 show the incompetence or premature labor pains. See the different parts of the fetus. Liquor appears to be okay or adequate. The fetal parts, they are seen and everything appears to be normal. Now I would like to focus on the umbilical cord vessel to find out the ST cord ratio. ST cord ratio is the systolic over diastolic blood pressure ratio in the umbilical vessel. The resistance is more in the early pregnancy while it decreases as the pregnancy advances. Now in this case it is 2.8. That appears to be normal. So there are some other signs that can show you the gender within the pregnant lady. Heavy face or bulky face in the female may show the male gender. The thick and dense hair over the female body can predict the male gender or the male baby within the uterus. The thin and shining hair pattern on the female face or body may show the female gender. In case of male, there is more acne on the face of the female. So the baby is at 30 weeks of pregnancy and weight is 2 kg. That appears to be normal. Where you have find a lot of signs to predict or determine the gender. In this pictorial evidence, you can see the bulky face that is characteristic of male fetus, while the female fetus result in the slim face or thin and shiny skin, rather bulky face. So in case of female baby, the tummy may be bulky or protuberant towards epigastrium, while if the fetus is male, the abdomen is flat. Viewer, please like the video, share the video and subscribe our channel. And if you have query, please write down your queries in the comment box.